Salam Alaykom. My topic today is about hydronephrosis. Hydronephrosis, as we can see this word, it consists of two syllables, hydro and nephrosis. Hydro, it means water or urine. Nephrosis, it means kidney. So hydronephrosis, it means a kidney full of water or urine. So what's the definition of hydronephrosis? Hydronephrosis is the filling of the pelvic calyceal system with aseptic urine, non-infected urine. Please be careful, non-infected urine. Because if it's infected, so we are talking about another disease that is called pyelonephritis. And our topic today is about hydronephrosis, so non-infected urine. And here is anatomy of the kidney. So here is the renal pelvis, here are the calyces, the medulla, the cortex or renal parenchyma, and the capsule outside that surrounds the kidney. So they say that hydronephrosis is the filling of the pelvic calyceal system. So here is the pelvic calyceal system, here is the renal pelvis, and here are the calyces. So there is accumulation or hydronephrosis here, accumulation of water here. Here is the normal kidney and here is hydronephrosis kidney. See the difference between the two. So here there is a smooth curve angle. If there is a smooth curve angle between the calyces and the ureter, this means that the kidney is normal. If this curve or this angle disappears, so we will say that this kidney is abnormal. Like see here, the hydronephrosis kidney, there is like this, but here there is an angle. Also here like this, biconcave shape, unlike here. So there is this tension of the renal pelvis and the renal calyces. So what's the etiology of hydronephrosis? Etiology, it's any kind of obstruction. Obstruction can be here, here, or here at any level. In the ureter, at the kidney, at the urinary bladder, at the level of prostate or the urethra. So what's hydronephrosis? Let's give an example. For example, here the stone, if there is a stone here, this will not allow the urine to come downside. We all know that urine come from here up to downside. So the urine will stuck here and accumulate more and more, then return upward. It will return upward and accumulate more and more. So hydronephrosis will occur. And obstruction can be not only stone, for example, it can be, of course, calculi, tumor, clot, inflammation. At any level, it can be here, here. You see that they write them the same, here or here or here. And also, if there is prostate, hyperplasia, and carcinoma, this will not allow the urine to go downside, and this will make hydronephrosis of this part, accumulation of urine of this part, and the urine will go upward toward the kidney and accumulate here, and hydronephrosis will be occurred. Also, if there is a narrowing of the urethrovesical junction, because we all know that there is a sphincter here between the urinary bladder and the ureter. So if there is, the sphincter is narrow, so the urine will not go like this toward the urinary bladder. So it will accumulate here and there will be hydronephrosis of this part here. Also in the pregnancy, because of high level of progesterone may affect the ureteric muscles, and this will lead to atony of the ureteric muscles. So atony of the ureteric muscles also, for example, there will be obstruction and there will be hydronephrosis. Also, if the embryo at the late pregnancy, the embryo will develop and his head will compress and make obstruction of the ureter, and there will be hydronephrosis. Urine will not be able to flow downside. And also there is something important that we talk about the atony of the ureteric muscles because of the progesterone level. We want to know that this thing will go after birth from 2 weeks to 12 weeks. After birth from 2 to 12 weeks, it will fade by itself and disappear. So the ureteric muscles will again be normal. So what is now the pathology? Pathology, as we say, an increasing pressure leads to hydronephrosis. For example, if there is a stone here, the urine will accumulate more and more here, and this will make increasing pressure and hydronephrosis. Now this is important and beautiful. What are the types of hydronephrosis? There are two types, extrarenal and intrarenal. Extra, because it's outside of the kidney, as we can see in the pelvis, renal pelvis, and intra, inside. So because of that, it's intra-renal pelvis. This is about 40% of cases. This is about 60% of cases. And this is there is another names for both. This is pelvic hydronephrosis because in the renal pelvis, and this is the renal hydronephrosis because in the renal or close to the renal parenchyma, in the renal calyces inside the kidney. This is the pelvic hydronephrosis, and this is the renal hydronephrosis. Also, there is something we want to know, why this is like this and this is like this. Now we'll take an example of a balloon. This is only an example. We will say that this is here the renal pelvis, and this is here the renal calyces with the kidney. So here the hand is compressing the kidney and the renal pelvis, and the renal calyces. So if there is urine coming from here, from the ureter, it will go downside here and to here. But because the hand is compressing and not allowing the urine to go downside, this will accumulate only in the renal pelvis, accumulate more and more, and hydronephrosis will occur in the renal pelvis. So this is the same like this. We imagine that if there is a hand here compressing this. So if there is a hand here compressing here, the urine come down upside. It will not allow to go here inside, so they will accumulate here. So unlike this here we imagine the hand is here compressing both the renal pelvis, as we can see here, the renal pelvis and the renal calyces. So but it's not compressing 100%. It's compressing about some few, but the urine can go inside. So the urine will flow inside, and so it will go inside and make renal calyces. So here we remove the hand from here and we put it here. So but there will be no compression of 100%. The hand will not compress totally. There will be a space for water to flow, so they will flow normally inside the balloon as there is no compression. So they will go inside and fill all the balloon. So what's the degrees of hydronephrosis? There are 3 degrees: mild, moderate, and severe. Mild, for example, there is hyperplasia only of the renal pelvis, but normal function. Moderate, when the kidney loses its function about 20%, and here when the kidney loses its function about 60%. And here it will be chronic and destruction of the renal pelvis. What is hydrocalycosis? Hydrocalycosis is the hydronephrosis of one calyx. Here is the renal pelvis, the calyces, one calyx. Hydronephrosis of one calyx. Here we say that smooth curve, normal kidney. Here are the calyces, the renal pelvis. Here abnormal, biconcave shape, pelvic type in the renal pelvis, renal type. Here normal cupping, the shape of the calyces is cupping, as we see here. When very much water enters, they will be flat first. These are the degrees of hydronephrosis. First flat, then clubbing, loss of waste, till balloon shape. So what are the complications of the hydronephrosis? Complications, of course, in the site of the kidney. Also, there are another complications such as frequency of urinating, going to bathroom becomes more and more, and there will be pain while the person is urinating. Diagnosis. First diagnosis, laboratory diagnosis. We can take urine analysis, creatinine, bilirubin analysis. We can make ultrasound, dilated like here, hydronephrosis, dilated renal pelvis. Here CT scan. CT scan, it looks upside of us. Here are the kidneys, hydronephrosis of the kidneys. As you can see here, this is the vertebral column, the belly or the abdomen. Here our back, vertebral column, kidneys are here, retro, according to anatomical position. X-rays, hydronephrosis of this part after coloration with intravenous coloration, hydronephrosis of this part. Treatment. First treatment, if it is not severe, we can treat it by taking the urine out. If it's mild, for example, and there is hydronephrosis, we can take the urine out of our urinary pathway by a catheter through the urethra. If it becomes moderate or severe, and there will be a problem, big problem, for example here like this, there will be very much distended of renal pelvis, so we must make pyeloplasty. It's making taking some of the renal pelvis, separating the ureter and the renal pelvis, taking some of it and throw the part that we took away, and then reconstruction of the renal pelvis with the ureter. These are the treatment, and this is our topic about hydronephrosis. I hope that you will like this video. If you have anything, please, if you have any answers or anything you want to tell me, please make a comment, so I will answer you. And if there is anything you don't understand, I will also answer you. Thank you very much.